Hey everyone, welcome back, where we break down the science behind staying healthy, youthful, and vibrant. Have you ever wondered how a diabetes drug suddenly became the biggest name in weight loss? Ozempic and Wegovy are everywhere. Social media, celebrity interviews, even your doctor's office. But behind the hype, what's the actual science? What do we really know about how these drugs work? And more importantly, what don't we know? Stick with me. Today we're diving into the real story behind these so-called miracle drugs, backed by science and stripped of the noise. The hype versus reality. Ozempic and Wegovy, both based on the drug semaglutide, were originally approved to help people with type 2 diabetes. But something unexpected happened. Patients began losing significant weight, word spread fast, and suddenly they were being prescribed off-label for weight management. But here's the thing, this isn't just a fad. Clinical trials actually showed weight loss of 10 to 15% of body weight, and in some cases more. That's comparable to what we used to only see with surgery. So, what's going on inside the body? What is semaglutide? Semaglutide is a GLP-1 receptor agonist. That means it mimics a hormone our bodies already make called glucagon-like peptide 1. Normally, GLP-1 is released in the gut after we eat. It does a few key things. First, it tells your brain you're full. Second, it slows down how fast your stomach empties. And third, it helps regulate insulin and blood sugar levels. When semaglutide is injected, it amplifies those signals, making people feel fuller, eat less, and stabilize their blood sugar. Over time, this can lead to major changes in body weight. The big game changer was a clinical trial called Step 1, published in the New England Journal of Medicine. It followed over 1,900 adults with obesity, and those on semaglutide lost, on average, 15% of their body weight over 68 weeks. That's not a minor improvement. For many people, it meant dropping 30, 40, even 50 pounds. But it's important to note, the drug was paired with lifestyle changes. Diet and exercise still mattered. Risks, side effects, and ethics. Now let's get real. This isn't a magic shot. While semaglutide may seem like a magic bullet for weight loss, it comes with a growing list of physical and psychological side effects. Users commonly report nausea, vomiting, diarrhea, and constipation, but those are just the tip of the iceberg. And because it slows digestion, some patients experience more serious effects, like pancreatitis, gallbladder disease, kidney complications, and even suicidal thoughts in rare cases. Long-term risks, we're still learning. And then there's something subtler but just as serious, muscle wasting. Because semaglutide can suppress appetite so effectively, some patients are losing not just fat, but lean body mass. That's especially concerning for older adults or those with chronic illness. There's also the ethical concern. These drugs are expensive, not always covered by insurance, and now there's a global shortage, meaning some diabetes patients can't access medication they need because others are using it for weight loss. Also worrying, what happens when people stop taking it? Weight regain is not only possible, it's common. The drug doesn't cure obesity or change your habits, it controls obesity and changes the signals your body gets. And once you stop, the underlying causes, from eating habits to hormonal imbalances, often come roaring back. Still, it's hard to overstate how big this shift is. We've never had a pharmaceutical approach to weight loss that works this well for so many. But this isn't a one-size-fits-all solution. And it's not without cost, both financially and biologically. So, whether you're considering it or just curious, the key is context. Talk to a healthcare provider, not a TikTok influencer. Understand your body, your needs, and your options. Because true health isn't about shortcuts. It's about science and the choices we make based on it. Thanks for watching. If you found this helpful, make sure to like, subscribe, and hit that bell for more science-backed takes on health and wellness. Got questions about semaglutide or other health trends? Drop them in the comments. I'd love to hear from you. Stay curious, stay informed, and take care of your body like it's the only one you've got.